at the end of the table for us, move straight ahead. My guess is that you were shown both a POMP procedure and then some Endfeel tests for the Occiput. Okay? So let's see if this is what we've been doing in the past. So, if I am going to analyze his right occiput, and I'm going to pump it, passive motion palpation, I'm going to put this digit on where? Mastoid. This guy goes where?
TPSC1.
TPSC1, and what is touching right there? The posterior aspect of his mandible, which actually is an important contact area. I'll show you why. Yes. Posterior aspect of his jaw, right there. All right? Because as I flex him, right, just let your head go forward a little bit. What should happen? Well, I should feel the mastoid move relative to my C1 contact a little bit. But also, let's remember that the mandible is attached to what? Your choice is cranium or sacrum.
Cranium.
Right? So, as I flex his cranium, guess what happens to his mandible relative to this atlas contact? Yeah, it approximates. As I extend him, guess what happens to that mandible? Yeah, that space gaps, because that mandible is moving away from this atlas transverse. As I do a left rotation test, guess what happens to that mandible at the end? It goes away. That space opens up. And as I right rotate him, guess what happens? It approximates. As I laterally flex him, what happens to my contacts? Approximate. As I left laterally flex him, they separate. Okay, so there's my passive motion palpation of the occiput. Of course, I do the same thing on the other side. So far, so good? Let's talk about Endfeel testing. You use a can opener, right? This is called a can opener. So that where do you stick this? Base of the occiput behind the mastoid. Where do you stick this? Where is it?
We just took our thumb out.
Okay, well this basically is you're going to sort of pivot around this to actually get your thumb working. So you sort of stick it where the atlas transverse is. So it's basically just going to go along with your thumb. But here's my thumb contact here, and this knuckle is just going to rest lightly just anterior to that. Tuck your head down, and as he comes into flexion, I'm going to spring a little bit. Any tenderness there? Then I'm going to pull him back into extension. I'm going to follow the motion and spring it a little bit there. Anything there? Now, so that was flexion, extension, Endfeel, but what else do I have? Rotation and lateral flexion, right? So, could I use my thumb for those? I could, but I could also use this contact, this reinforced contact here. Personally, that's what I like to do because my hand can reach and follow him around, and then I can spring him. And I'm on his mastoid, right behind it, right there, and spring him into rotation. And then I'm going to pull him down into lateral flexion and spring across into lateral flexion. Spring, spring. So there's my rotation spring and there's my lateral flexion spring. Then I'd switch my hands, flexion, extension, rotation, lateral flexion. Okay, yeah?
So for the flexion extension, you look like you were kind of gripping the mastoid process.
Well, this is just spinning around the mastoid. Okay. This is behind the mastoid, helping to spring it up into flexion and then coming back in extension. Some people will just come in and just use the 2 fingers for everything. They'll come in here. Here's my flexion contact, spring. Here's my extension contact. Here's my rotation.
And why not? Right? Like, why can't you do that?
No reason. Now you're in second semester. Spread your wings. Time to fly. All right, here we go. Let's try it.